Good afternoon all judges and respected faculty and their colleagues. So my topic is slightly interesting as usually nowadays all are playing with tennis ball for playing cricket in gully, mohalla or in community. So we can see from this video that when ball throws at speed of 140, 150 kilometers speed, so it can hit head along with the eye, and even with the helmet you can see how the damage that can occur. So these are the famous cricketers. Some of have lost their life and some lost their career due to the severe eye injury. Most of the you know. So what is the difference actually? What is the tennis ball? This is the softer category marker. This is the softer category. This is green ball, which weight is 56 gram only, and this is the leather ball. The weight is 155 gram, and this tennis ball give high bounce, and this leather cricket ball the less bounce. So nowadays the young adults they choose this red tennis ball actually. That gives the true bounce, and the weight is nearly equal to leather ball, and so that's why the velocity and mass that ultimately lead to momentum. Momentum can damages the internal structure of the eye. So you can see that in any community they don't use the helmet while playing this type of tennis ball for cricket, but the same intensity of the regular cricket. So we wanted to do a study as we got some patient retrospective study in Glaucoma clinic from January 2023 to 24 to see the management outcome of blunt trauma due to tennis ball injury. And all the patients registered in the OPD and Glaucoma clinic were screened. We took the patient which only with the tennis ball and that means post-op at least 6-month follow-up. So we got a number of patients, 6 patients, and 3 were batters and 2 were fielders, and 1 was even bystanders. She was just watching the play. And mean highest baseline pressure of 42.5 mm mercury, visual acuity had movement close to phase 618, and all had angle recession more than 180 degree. 4 had a hypema, 1 was full hypema, which were denied later, and 1 was with subluxation of lens more than 120 degree with vitreous collapse into AC. 2 had posterior pathology, and medical management did 2, and 4 we took for the surgery. So this was a surgery, trabeculectomy with simple MMC, and 1 was Ologen, another with trabeculectomy failed. After that we took AGV, followed by cataract surgery. Then another was cataract surgery, sinus fixation of IL, followed by TRAV, then followed by blame needling, as that was TRAV was failing. So out of 6% vision improved in 5% significantly from presentation. IOP also reduced 16.2 mm mercury with 3 absolute success and 3 with qualified success. 1% did not improve with persistent low IOP and has also retinal pathology, visual acuity PL plus, PR inaccurate, and post-op. So these are the medical management cases. You can see that the 2 cases were there. I have to put one photo. You can do 270 degree, that means sphincter tear, and both needed 4 medication in the beginning. And after 6 months, after the inflammatory was recovered with 2 medications, mean IOP was 16.5 mm mercury. And these are the surgery case. First case was the TRAV with simple MMC. This case was with after irrigation aspiration of the hypema. We have to do the TRAV with the Ologen, and after that the IC was shallow, and there was some CD. And but after 1 month, that is good. That means CD was resolved with IOP was 10 mm mercury. This case, after failed TRAV, we had to do a AGV. After that, cataract formation. Then we have to, as the case was persistent low hypotony, we put a 50 Fluorine suture in the tube, and we have to remove the IOL, but still we could not save the eye. That saved the eye in persistent hypotony with the PR inaccurate because it had also posterior pathology. And this was the cataract case with subluxation of more than 120 degree. You can see the vitreous collapse into the eye. So we had to do the IOL, that means lens aspiration with vitrectomy with shunt fixation. Then IOL placement. Then after that second setup we did the trabeculectomy, which was failing, but after with 1 blame needling and with 1 medication, the patient is following with good 624 vision with IOP control. So what the closed globe injury ball, it can, as you know that there are 7 rings, it can damages from the anterior segment to the posterior segment with all the rings, as you know, the iodialysis, cyclodialysis, hemodialysis, and at last retinal dialysis. So from this study, what clinical implication this carries this study? I want to just present, say the message is that as nowadays they are mostly playing with tennis ball. Patient with the blunt trauma with tennis ball are to be followed regularly for the development of glaucoma. And management posterior glaucoma due to this tennis ball also is a complex procedure as it need to handle lens, vitreous, retina, and may need multiple intervention also. And the message to the community should be take precautions, proper precautions while playing cricket using a well-fit helmet, because the helmet has various types also. with his the nose brow that cannot prevent the injury even with a soft tennis ball, and the bystanders should be safer distance, should be vigilant. So that is my message, and this is our team. So thank you.
So what was the average duration that the hazard presented to you?
Sorry,
in your
ma'am. Average duration.
duration the you did the surgery.
Duration as our is a tertiary center. Most of the from neighbor states also, like from our Bhubaneswar, West Bengal also, they presented with just after 2 months. But once the hyphema cases they are presented early, we did hyphema drainage, and after that also we did angle decision there. But average what 2 to 3 months.
I'm asking the
Mean
duration between the AC
acid tap.
is
Acid tap and glaucoma surgery.
yeah the
Acid
average
tap,
duration.
glaucoma surgery, as the eye was not controlled even after 1 month with all the medication and Dimax, so we had to take surgery.
See, I would like to ask you one thing. As ma'am already asked, see, angle recession, the glaucoma doesn't develop so early.
Ma'am?
It's somehow, how many times you have got angle recession glaucoma just after the injury and the development of glaucoma, that gap period? Because angle recession is a late finding.
Yes, it is a late finding.
Yes.
But in our cases, most the medical management cases, we did not. That means surgery was not needed. That high IOT did the inflammations, because not only first at the first angle decision, but the other inflammation factor maybe, and the hyphema was the vitreous prolapse. The cases was that case was not resolving after 3 months. So that was with angle decision. There vitreous was also in the antechamber, and another case that with the AGB, that was a long-standing cases of 6 months.
First thing, because as for our knowledge, ankle recession is a long-standing complication, not immediate complication.
Yes, ma'am.
So,
but
what is the duration of the injury and ankle recession you got?
Yes, ma'am. Angle lesion, what I written in later book, that it can from 90 days to 9-10 years, up to 9-10 years it can develop also. But in my opinion, after 3 months it will present, ma'am.
So you got your first case after 3 months?
First case, hyphema cases after within recent cases. Other cases are after 3 months.
So that could
Because
be red
that
cell
was
glaucoma or
referred from
inflammatory glaucoma and
other
not an
center.
angle recession.
Pardon, sir?
So that could be a red cell glaucoma or a
Exactly,
hyphema-related
that is
inflammatory
what
glaucoma,
I was
not an
thinking.
angle
Yes,
recession.
ma'am.
Not necessarily
I
ankle
mean,
recession.
I am not saying that angle recession the only cause. I am not
Okay,
saying that.
yeah.
All had angle recession.
Huh.
Because that all are blunt trauma, so all had angle recessions. So if the angle recession is more than 180 degrees, then that chance of glaucoma is more, 70% chance of glaucoma is more. But all the glaucoma is not due to only angle recession.
Exactly.
Yes, that I agree.
So there are two more things that I wanted to ask. Have you done any statistical analysis with all of these? Any odds
Sir,
ratio?
as were 6 patients,
Small.
static
Okay,
analysis,
so
Small group.
vision
some
only
odds or
improved
something
that
like
with
More
variety
like
of patients,
Most like
and
case
I have
reports,
to go only the tennis ball, the
Tennis,
red
okay.
tennis ball. So I want to
There's
message that
another
only.
thing is that when did you do your gonioscopy assessment, or were you doing it on anti-segment or OCT, or what is it? After the imaging. So how were you diagnosing your angle recession at what time?
Sir,
I mean, when were you putting your
yes, sir, yes. Gonioscopy, if the patient is coming after 2 days, after 1 day, 3rd days, we don't do actually gonioscopy, but
Absolutely.
written, because it will dislodge the clots, etc. But other patients are like after if patient coming 1 month, 2 months, 3 months, then you can do gonioscopy, sir.
So were you doing an anti-segment OCT or something like that?
Anti-segment OCT, we
You
have
look
not
for the
done
angle
in
recession.
this case.
Okay,
Yeah.
fine. And the last thing was, did you look for cyclodialysis clefts or
Cyclodialysis clefts are 1 to 2% there, but that is minimal.
okay? And traumatic reserve loss. I mean, did you
Yes,
see
sir.
traumatic reserve loss? If you pull my hair, suddenly I will become bald in particular areas. So did you look for traumatic reserve loss in the retinal nerve fiber layer?
Retinal, 1-2% is posterior pathology. That was that means retinal thinning was there, and one is vitreous.
Commotio retina. Did you see commotio retina and then associated?
Commotio retina, nahi. That patient was with retinal thinning already had come, and one is vitreous hemorrhages.
Thank you.
Sir, I have one thing. So don't you think it can be related to optic nerve pathologies, the vision loss? That is what, maybe to optic nerve had avulsion. Have you done any radiological investigation in relation to optic nerve canal? Because vision loss may be because of that also, right?
I understand. Optic
Yeah.
nerve, because the 4 has no posterior pathology, That 2 cases which posterior pathology, that optic nerve avulsion sign was not there, anything. We have not done actually CT scan, etc.
Okay.
Okay, ma'am.
So we'll move to